Good afternoon, everyone. Thank you for joining us for our second Brown Bag webinar. My name is Melissa Graham with the National Aging and Disability Transportation Center, and we're so glad that you were able to join us today. Just a quick, some quick housekeeping rules. This webinar is being recorded, so you are able to go back and listen to this or share with any colleagues if you choose. If you want to ask a question today, and we hope that there are some good questions after our presenter speaks today, please type your question in the Q&A box at the bottom of your screen. We ask that you try to use the Q&A box rather than the chat, so I'll know that that your questions will certainly be answered if you do put it in the Q&A. You can also, if you are only in listening mode, email your questions to hedmonds@n4a.org, and I'll get those questions that way as well. And also, we recommend that you connect to your computer audio versus the telephone so that you're able to hear the media today. And so just quickly, a quick agenda. I'm going to show a video that features our presenter today, which is Mitch Rosa with Shared Mobility, Inc. And then we will turn things over to Mitch and again, have a facilitated discussion and Q&A. So we're looking forward to your questions. We only have 30 minutes, so I want to go ahead and jump right into it.
From the shores of Lake Erie, Buffalo's skyline looks sparkling. But for those in outlying rural communities of Erie County, Shared Mobility has developed a shared ride volunteer transportation program.
And one of the challenges we identified was that older adults and people with disabilities, specifically in rural areas and in the sprawling suburbs here, didn't have a lot of transportation options to get around.
Shared Mobility
time to help people.
The population for volunteer drivers usually is retired senior citizens. So that's kind of the market that we try to target. I'm out in the community searching out these kind of folks.
A 2018 National Aging and Disability Transportation Center poll found that older adults and people with disabilities have difficulty finding transportation in their communities. This is due to a lack of affordable and accessible transportation options. To address this issue and to help identify innovative solutions that could be used in other parts of the country, the National Aging and Disability Transportation Center awarded a grant to Buffalo's Shared Mobility. The challenge to connect volunteer drivers to older adults and people with disabilities who need transportation to medical appointments in Erie County and Buffalo. With the support provided by NADTC funding, Shared Mobility is working with the Volunteer Transportation Center to develop a volunteer driver system. The first step, outreach.
I've gone to county fairs. I've set up at a local grocery store, set a table up in the lobby. I let them come to me and ask the questions, and I know they're interested. We go through the orientation process with them. They fill out an application online or in person or mailed. We do a complete background check with DMV and criminal history, and once we get that back, we sit them down with an orientation. Then if I feel like they're a little leery about it, I'll assign them a trip and then accompany them on the trip, just to make them feel a little bit more comfortable and kind of learn the ropes before they are set off on their own.
They're not there because they need a job. They're choosing to be there, and they're providing a ride to somebody that has no other option. The experience, 99% of the time is just outstanding. They really have a human connection. The culture that you create and the bonds that you create with the volunteers is what makes the whole thing work.
People can say, yeah, I am a good Samaritan, but I love what I do, and it gives me a little chance to get out, move around, and enjoy other people's company, because otherwise I'd be at home alone.
Today, Rita Fillowig helps out Cheryl Smith, who needs physical therapy after surgery.
I was going through cab companies, and they would be a no-show or show up extremely late to where I missed my appointment. I'd have to reschedule. So I ended up going with VTC, and they actually call me the night before. They make sure I know my driver's name. My driver calls me that morning or texts me and tells me that they're on their way or they're here at my house.
Lori Smith has cerebral palsy, and for her, transportation is critical. She has a limited income and relies on the free ride services provided by Shared Mobility.
Say your insurance isn't going to pay for that transportation, or like, for instance, I also do a wellness program right now for physical therapy, which is not covered by my insurance. So I have to find personal rides to get there, and that can be a problem. I'm here to tell you that this program is good. It makes you feel like you can be a member of society. You just don't have to be, shut in or shut out.
And we hope that as we build a bigger volunteer base, that begins to snowball. We have 5 volunteers, turns into 10, turns into 15, because everyone we've had volunteers so far has had a very positive experience, and we want to keep that going.
Thanks to NADTC funding, Shared Mobility has achieved success and learned valuable lessons along the way through community cooperation. The goal, to help other communities across America implement similar transportation innovations.
Well, we're excited to have you here, Mitch, today with us, and looking forward to your presentation. So without further ado, the floor is yours.
Yes, thank you, Melissa, and thank you all for being here today. So to build upon all that in the video, I want to just take some time to really explain what we do here and what we've done over the last 2 years to build this program up to where it is. So as Melissa said, my name is Mitch Rosa. I'm the program director with Shared Mobility, Inc. A little background on us is that we've been around for 11 years in this space. We were founded as Buffalo Car Share back in 2009. That was the first social equity focused shared mobility program in the nation. Since that time, we've transitioned beyond just car sharing and now do work across all shared transportation modes, including bike sharing, volunteer transportation, and everything in between. So we're a national nonprofit, and we do everything in this space between research, development, and actual program operations. So we got involved in NADTC back in August of 2018, and we came to them with a research question as part of their grant cycle saying, we're following the shared mobility industry very closely, and we don't think that this industry on its own is doing what it can to serve older adults and people with disabilities. There's a lot of improvements that can be made here. And we wanted to take the time to do a deep dive into that and figure out what are the major barriers and how can we overcome them. So through a 6-month research process with some focus groups, industry-wide research, and talking to stakeholders from across our region, we were able to come up with 4 major barriers for older adults and people with disabilities when it comes to shared transportation: physical, economic, geographic, and operational. Either folks are not able to use shared mobility because they physically are not able to and there's not accessible options. They can't afford to use the programs, like in cases of Uber and Lyft, where ride costs can be excessive for folks. They live in rural areas where shared mobility programs don't serve them or don't serve them well. And operationally, which is almost the most rooted problem, where programs don't know how to serve older adults and people with disabilities. Staff is not trained well, and there's not an operational focus on serving these disadvantaged groups. So throughout that process, we developed different solutions, and we came to focus on one as we move forward with the rest of our grant process with NADTC, and that's on volunteer transportation systems. The volunteer transportation is not considered traditional shared mobility. It's maybe not as notable as bike sharing or car sharing programs are in many communities, but the work volunteer transportation operations do is just as critical. So we connected with the Volunteer Transportation Center, as the video noted. They're based up in Watertown, and their volunteer transportation system is very impactful in their region. They have 350 volunteers who do 150,000 trips annually, generating 5 million passenger miles every year. They have been around for over 25 years up in the North Country. They serve an area about the size of the state of Connecticut, all the way up at the top of New York State. And they use an innovative back-end driver management system that they've developed in-house, sort of like an Uber and Lyft back-end to manage drivers, but can allow the program to scale differently. So we know VTC's system is great. We know that Western New York State has got a lot of issues in serving our population we want to serve. So our goal was to replicate VTC's model to serve the target population back in our region. And so alongside Volunteer Transportation Center and our other partners at Mobility Development, we developed and deployed volunteer transportation in Western New York. So we started in Erie County, in the rural areas around Buffalo. That's the lower left side dot, focusing on the northeast side of the county and the south towns, our southern suburbs and rural areas where folks have the least access to shared transportation, public transit, and have the highest concentration of Medicaid patients who need rides to medical appointments. We spent the first 8 months developing our system in those areas, and now we're transitioning to developing the system across the region, beginning with Genesee County out in the east and Niagara County to the north of Erie. So we're engaging in a process with the FTA and our current grant to do that expansion. So far, what we've done is a lot of volunteer recruitment. Building the roots in the community has been some of the most key work we've been able to do with NADTC, and we've learned a lot of lessons along the way. VTC is a very well-positioned program up in Watertown, and as I mentioned, they have a base of 350 volunteers, but they didn't get to that point overnight. They're a known entity, and people actually come to them to volunteer, and they have such a great reputation in their community that their volunteer base is fairly steady. We, on the other hand, had to make a lot of inroads in our communities to both introduce the concept of volunteer transportation to a lot of folks and make it accessible and accessible to folks who wanted to give their time. So that process consumed most of our grant time with NADTC, but the results of that have paid off to the point now where we have an operable volunteer transportation system in the region, and it's growing as we speak. So our program impacts, as I said, we began our research in August of 2018. By September of 2019, we had successfully launched the program with a handful of volunteers doing pilot runs in certain parts of the county. And since that time, we've grown a lot. And in the first 5 months of this year alone, we've done 600 trips in the region. At this point, we have a dozen volunteers, all of whom stayed on during the COVID crisis. We deployed masks and gloves and distributed hand sanitizer to volunteers, as well as did a little bit of operational shifting. At this point, we're only providing life-sustaining trips during COVID. So that's primarily dialysis, cancer treatments, and methadone treatments. But the program is off and running, and a lot of the great community outreach work and different strategies we use to raise awareness of our program in the region have definitely paid off now that we've grown since that time. Additionally, there are some impacts that our program has helped to fuel that are outside of the Western New York area. A lot of the lessons we learned here in volunteer transportation have helped our programs across the country. In this case, MeoCar is a program we support and run in the San Joaquin Valley of California. It's 27 electric vehicles and a car sharing program that serve low-income housing communities across that region. So that was primarily funded through the California Air Resources Board and a grant through the Department of Energy from the federal government. So that car sharing program is deployed, but we're looking at options now to incorporate a new volunteer transportation element to that program based on what we've learned a little bit from our Western New York work. So that project is currently in development right now. We're thinking about it, but one of the great things that we've been able to do is take a lot of the lessons we've learned from our work in Western New York, such as the community connections that need to be made operationally, where we can serve, and how we can best translate a model that we know works very well in a well-established rural area in VTC's home counties, and transition that to other geographic and economic settings. And in Western New York State, that's a bit more of a metropolitan setting. We know it works well in the rural areas. That's where we started, but can this work in the suburbs? Can this work in urban areas? We're taking steps to find that out. So where volunteer transportation has been an option for a lot of communities for decades and really has been around since even the car began, we're trying to push that model out and incorporate into different programs. So we think that the MeoCar platform provides a good opportunity to do that. Overall, though, so we've been able to leverage our programming to support public-private partnerships in our work, both in California and in New York State. I think the Volunteer Transportation Western New York program is a great example of that, MeoCar as well. So we're taking those lessons and incorporating them into other programs, as I said. Ultimately, the bottom line impact of this is we're saving money for publicly funded medical transportation. A good amount of the clients we serve with Volunteer Transportation Western New York, and about 80% they serve with VTC, are clients that are with New York State and need access to non-emergency medical appointments. We provide an option that gives them consistent access to this and ultimately lessens the financial burden on the state to pay for those trips. So it's an overall net benefit to the state and our communities. And lastly, we're working with NADTC to plant the seeds for future growth. We came into the project with them in early 2019, wanting to do Erie County. We've been able to leverage that into FTA funding to do more region-wide work. And as I showed on the map earlier, we're moving into Genesee and Niagara counties, but the real goal is to serve all 8 counties in the region. So we're taking step-by-steps to do that. And NADTC provided us a great opportunity to form the operational backbone of the program, the administrative backbone that's allowed us to grow so that we're not replicating the model in each county. We're simply growing our volunteer base and growing our service area as we move forward. So our next steps from here are continuing to serve Western New York through the VTWNY platform. We're going to be publishing the key research findings from some of the research that I mentioned earlier. So that incorporates our findings on volunteer transportation, bike sharing, car sharing, as well as ride hailing as well. So we're going to be making those publicly available soon in partnership with the NADTC. And lastly, as I also mentioned, we are currently funded through the FTA and their Human Services Coordination Research Grant Program to do more of this expansion through 2021. So we will continue to grow and continue to move our work forward in our region. And thank you very much. I think, Melissa, we want to open the floor to questions from the portal then?
Sure, absolutely. Thank you so much, Mitch. And just for everyone out there, I don't know, there may have been a couple of times that Mitch may have gone silent. I know we're all working from home these days, and internet and Wi-Fi and even Ethernet is kind of acting a little wonky. So I do apologize. So if there were some things that you may have missed that he said, please ask a question or clarifying question. But we do have a few questions that have come in. First question, Mitch, are you buying the vehicles for project? And I hope I'm reading this correctly, David. Are you buying the vehicles for projects like MeoCar or maybe it's MicroCar, or are they leased?
So the MeoCar vehicles are leased through that program.
Sorry.
Yes, no, that's okay. The MeoCar vehicles are leased. So we don't really know exactly how we want to incorporate volunteer transportation into that project exactly. But we know we have 27 electric vehicles in these communities. We have a fairly active user base that wants to be engaged. So we're doing what we can right now with our partners in the San Joaquin Valley to develop a solution on that. And the vehicles are leased, so we still have agency over that program, and we're the day-to-day managers of it, but I don't have all the specifics of that just quite yet. That being said, we know that there's a lot of potential to cross volunteer transportation over into car sharing and into ride hailing. So we want to explore those possibilities and keep our model pretty open-ended so that we can continue to innovate.
Great, thank you. Next question, do the main savings accrue from labor cost savings because the drivers are unpaid volunteers?
So our volunteers are not unpaid, and I maybe should have mentioned that in my presentation. Our volunteers receive 58 cents a mile reimbursement, which is the IRS rate for that. The savings come from the fact that state-funded taxi and livery service tends to be more expensive per mile, just with the rates that are agreed upon with service providers in this area. So even though we do give the volunteers reimbursements, we are able to still save money in that realm. So where it's possible, we provide that low-cost transportation option for the state and give people more access to it in that way. But the volunteers are reimbursed.
Great. And so we've got a couple questions about insurance, and so I'll kind of try to combine them.
Okay.
So someone asked, has there been any issues with volunteers maintaining their personal vehicle insurance or being charged more for their policy because they volunteer to drive? And then also another question was asking if you face any issues with insurance companies regarding any extraordinary coverages.
So to my understanding, no one has faced any insurance problems in their own personal insurance for being a driver. I can't speak to the the whole breadth of volunteers and all the systems, but at least locally, we haven't had that happen. And then in terms of how we carry insurance, we carry insurance for extreme events, but utilize people's individual personal car policies for their driving. So VTC has had that system worked out for 25 years. So we were able to take a lot of their lessons in that field and adapt them right into our system. So we didn't have to go through a lot of a steep learning curve on all of that. And I think that was one of the really helpful and fruitful ways that our partnership has come together. You know, we know Western New York very well, and we knew how to guide that community deployment. VTC had the strategies in the playbook on operations, doing specific outreach, and how to onboard volunteers. So we didn't have to reinvent the wheel in all of those ways. And insurance was definitely a way that they helped us out.
Okay, great. Thank you. Someone asked if you could tell us more about volunteer driver recruitment and rider recruitment. What media and outreach methods work best?
So we didn't have to do a lot of client outreach. There are plenty of partners in our area that have folks that need rides to places. So we were able to partner with social services, agencies, the state, medical providers, that folks who need rides are out there. And that's, again, what sort of VTC has pioneered in this, is creating a stable base of clients through those partnerships. And that's able to generate revenue and generate usage that you can give back charity trips to folks who need rides to the grocery store and the pharmacy that aren't necessarily associated with any service provider. And about 1 million passenger miles a year of their trips are just in charity. So we are able to utilize that model to pretty much stabilize our client base, and that's been helpful. Volunteer recruitment, on the other hand, has been a real big focus of our efforts and wasn't a focus of the efforts during our NADTC grant. And to be frank, that process took a little longer than we thought it would. And I think that speaks to the fact that you really need to build yourself and embed yourself deeply in the community as a program. So we were able to do that over time, making those inroads. In terms of mediums, we are doing everything from putting up lawn signs, and we were doing hang tag flyers at community centers, to doing targeted social media posts for age demographics and interest groups we thought would be useful. As Luann said in the video, the target demographic for most volunteers is recent retirees, people who want to stay active, mostly 55 to 75 years old. We had a pretty good success connecting with them on Facebook. We also looked into doing targeted ads at folks who have interest sets in volunteering, Uber and Lyft drivers who are driving and may want to give back in their time, while they're out and about. So and then everything else between going to Kiwanis Club meetings, Rotary Club meetings, sitting at grocery stores and tabling, going to the library, having coffee with folks. It's a very in-person process, and you can utilize many different methods to get people interested. But what we found over this process is that to get people to sign on and actually give their time to be a volunteer driver, you got to put that in-person work in and get them acclimated to the program, build that trust and buy-in. And once you have a core group of people who are doing that, then the volunteers begin to recruit other volunteers. They have friends, relatives, colleagues that are interested in it. Then the interest begins to generate from there, and that's how the barriers of trust get built out from the program. So it was an intensive process, I would say, but it was really worthwhile, and we think that we're in a good position now where we're very ingrained in our community to continue to do this work and to continue to support our work through the help of our volunteers.
Wonderful, thanks so much. Another question along the lines of your recruiting strategies and just the overall process. Someone wanted to know how your volunteers are vetted.
So they go through a background check process that VTC has established that does a background criminal check on them. We also do a vehicle inspection, so that their vehicle has to meet certain standards. Similar if you wanted to drive for Uber, your vehicle has to be 10 years old. We didn't model it after that, but there's a similarity in inspection. So we'll do an in-person inspection of the vehicle, but make sure it's clean, make sure your insurance is up to date, it's in good operating health. And so then they do the background check, the vehicle inspection, waivers. So the volunteers are vetted through those processes. And as I said, VTC helped establish those. So we were able to lend ourselves through a lot of that process that already existed.
Okay, thank you. A question about software. Can you describe the software used and what the essential functions and or features are that's provided?
Yeah, so the program is called SNAP, the Simple Neighborhood Access Platform. It's an in-house platform that VTC is developing to help with their operations. So it's a driver management platform that allows us to track the drivers, clients, the trips, log miles, assign trips, do scheduling. And it's basically a great sort of ride-hailing style backend platform that allows the program to operate at a fairly significant scale. It also helps with expansion efforts. So we were able to use Snap and do some of the piloting work during our time with when we were starting the program up. So as they're developing the 2.0 version of the platform, a lot of the work and the time that we did in Western New York helped to refine that. And that's gone into the California-based work as well. It's helped the Watertown system. So there's a bit of a learning collaborative in that as we develop the platform. But VTC has their developers in-house working on this. It's a platform they've been working on for several years. So they are coming out with the second version of it at some point this year. I don't know what that future holds with them and how they want to broadcast that to other systems, but it's been very instrumental in our work to scale this program and to look at it more as a shared transportation option.
And is that Snap software, is that just something that you all use, Mitch, or is that, I know you said, is it available for other programs?
At this point, it's not available for other programs. I don't know what the future holds in that for VTC, but at this point, they're drilling it down in their systems and their partner systems. So we use it for our system in Western New York, as well as they use it up in Watertown.
Question from Darcy. She asked, do all the transportation services target medical appointments and care? If so, any future plan to get people with disabilities to work through volunteer rider recruitment? She did apologize if it was answered earlier. She got on a few minutes late.
Oh, no, that wasn't answered. That's a good question, Darcy. So a lot of our work is non-emergency medical transportation focused at this point, but there definitely is a push that we want to have to utilize this platform for other things. One medium we've been trying to explore is how can we use volunteer transportation to supplement workforce access for folks in fringe suburban areas of Western New York. Western New York has a very big sprawl problem. So the fixed route transit and by extension paratransit can only go so far and doesn't meet all of the job centers that are a little too far out from the urban core. So we're exploring ways to be a connector to that and to help supplement those programs during off hours and off times. And I think that when we're able to figure that out, that would definitely be a benefit for older adults, people with disabilities, and anyone who's transportation disadvantaged in our region. So we're definitely exploring options to get outside of that bubble. And I think this platform has really given us a great way to explore solving non-traditional transportation options in our region.
Social services help to maybe cover some of the costs of the rides.
I'm sorry, Melissa, you were cut out for the first half of that. I didn't
Okay, no problem. So the first part of the question, how are volunteer rides paid for? And then there was another question around paying for rides. Could you elaborate a bit on how your partnerships with organizations like social services help to cover some of these costs for the rides?
Yeah, so it depends on which partner. The primary partner we have is New York State and its extension Medical Answering Service, which is the transportation broker for Medicaid trips. So they cover the cost of the trips at an agreed upon rate per each county in a similar way that many of the social services partners that they have in Watertown and the North Country region do. So we're scaling up those partnerships in Western New York, but up in Watertown, they have partnerships with social service agencies, local transit, and they do everything from visitations to pharmacy pickups to a variety of things. So just for the sake of time, I can get one more question in here. The partners themselves agree upon a rate and a client base with the volunteer program. So it's different from partner to partner, but essentially there's agreed upon rate for the trips with that outside entity, and they're paid for through whatever funding streams they have to give to that.
Okay, and we are at the top of the hour, but I wanted to ask this final question because I'm sure many people on the call who may be looking to start a volunteer transportation program may be interested in hearing your response. So Kay Hightower asks, what are the upfront costs in starting a volunteer transportation program?
The upfront costs are a lot of time. It's a lot of time to build this, and there's no other way around it. You need time to go make those connections in the community, to build those relationships with folks that can really make some key impacts for you later on. We had everyone on our staff, specifically Luann from Volunteer Transportation Center and Rachel Heckel from Mobility Development, who are out in the community talking to folks all over town, raising awareness for this program and getting out there and doing it. You know, we had a very supportive partner in VTC, so as I said, we would take a lot of lessons from them. But to make this question a little longer than I think we're going over a little bit of time, but basically you need to define who you want to serve, what kind of trips you want to serve, and take time to really sink a lot of sweat equity into being ingrained in those communities. If you want to serve older adults and people with disabilities, you need to get buy-in from those groups. You need to get buy-in from whatever local volunteer base you need. So it's the cost of time to do that building, finding a platform or an organizational system that's going to allow you to perform those trips. Whether that's getting a SNAP kind of program to come in, there's different white labeled versions of similar programs, or if it's you simply organizing those trips on your own and looking at making it ways to scale when you get there. So there's a variety of costs involved in that, but for the sake of brevity, specifically, feel free to reach out. My email's on the screen here. If anyone has any questions, I'm happy to answer them in more in depth later on. But there's a lot of costs in it. But that being said, there's a lot of benefits and payoffs, and the most direct benefit and payoff is that people in our community are getting rides to places they need to go that they may not otherwise had access to before we were able to do the work to get them there. So it's been rewarding, and it's been a program that we've been excited about for a long time. So now that the wheels are turning, we're glad that we're growing and can keep doing so in the future.
Great. Well, thank you so much, Mitch, again for your time. And thank you everyone for joining us. Today, our next Brownback webinar will be on June the 25th, so we hope you'll join us then. I will be sending out a recording of this webinar as well as Mitch's presentation slides and a short survey. If you can answer that, we would greatly appreciate your input. But again, everyone have a wonderful afternoon, and we'll see you next time. Bye-bye.